Actually giving me the opportunity to be here today and share with you this research. This scoping review is part of my PhD study, which will be developing a telemedicine framework for podiatry. And what I will be presenting today is the first phase that we've already planned and concluded. So, as you all know and you've all experienced, with the pandemic, with COVID, all right, we had to find other means how we can see to our patients, because we had to cancel most of our appointments to mitigate the spread of COVID, and telemedicine was one of the modalities used to try and help as much as possible our patients still, even without seeing them at our clinics. So why the study? As I mentioned, this study is part of a much more broader study, and in this phase here, we want to actually identify, all right, what recent telemedicine guidelines are already available for foot and ankle in primary healthcare. Also, we wanted to compare these guidelines, the existing guidelines that were made available to check their content and their rigor as well. So far, the research that has been carried out in telemedicine and related to feet, but not to core podiatry per se, were on the diabetic foot, on wound management, and also musculoskeletal injuries and other complications. But at the moment, there are no specific guidelines that podiatrists can use within their clinical practice and to conduct a telemedicine consultation. So, from all the studies and from the extensive research that has been done, the studies indicate that telemedicine cannot be, the guidelines used for telemedicine cannot be universal to all professions. They need to be tailor-made to the specific profession they need to be used. So, for example, telepsychiatry obviously cannot be implemented the same way for podiatry, because they have two separate functions, okay? So the method to conduct this study was we followed the PRISMA guidelines for a scoping review, and a combination of databases and grey literature were used, and also the databases that we used were PubMed, Medline, the Cochrane Central, and the CINAHL, and we also included Google and Google Scholar, just in case we missed out on some other articles that could be useful for this research. A number of key terms were used for telemedicine, foot health, and guidelines, and the search time frame was, there was a time frame between 2012 and 2022. After finishing the search, these records were then imported onto RefWorks. So the inclusion criteria for the study, mainly all the studies that were included had to be within a primary healthcare setting. The articles had to be related to foot and ankle management and related as well with patient consultations. Guidelines, practical guidance, consensus statements, expert opinions, case studies, editorial narratives were also included, as long as they were from peer-reviewed journals. And also telemedicine practice guidelines, which were produced by international bodies, were also included. You can appreciate that during COVID, international bodies actually from around the world had to come up with some sort of guideline for their professions, but they were not, some might have lacked technical, some might have lacked non-technical and even clinical domains. And also the records, the articles that were included had to be in full text and in English. The exclusion criteria, mainly we did not want to include articles that did not focus on a real-time consultation, so we eliminated any form of studies that were not real-time. Also, articles that were concerned with lower limb wound management were excluded. Articles where healthcare and medical students utilized telemedicine were also excluded. Letters to the editor, patient education leaflets, and anything that lacks any clear instructions on telemedicine for patient consultations also excluded. And also any telemedicine practice guidelines that do not fall within the scope of foot and ankle management. So from this flow chart here, we can see that we identified 356 records from the databases, and an additional 6 were retrieved from the Google and Google search, and 1 was also highlighted from the article references. After screening and following the eligibility criteria, we then ended up including only 9 studies, okay, 9 records. So the data extraction and the synthesis of this whole process, basically we checked and we looked into the research country where these studies were conducted, the study design that was taken into consideration, the outcomes sought on the study, the function telemedicine had in their study, the target population, which was always targeting primary healthcare patients, media, the type of media communication that was used to conduct a telemedicine consultation, the methodology, and also the limitations of the studies. Then we proceeded to carry out a textual narrative synthesis, and we came up with a number of themes that derived from these studies. And this was then discussed with the other reviewers for consensus. So as for results, as you can see over here, there was a spike in total studies screened, the total studies screened for eligibility. There was a high number of foot and ankle management using telemedicine in 2020, which stands to reason because it was the year when we had COVID. So at that time, we had to pick up on this subject very quickly because we were incorporating telemedicine in our clinical practices. Also, the main function that telemedicine had was to provide treatment and follow-up for the majority of the cases from these studies. The preferred mode of communication was with the use of video conferencing platforms because they believed that it was the closest you can get to an in-person consultation. And the outcomes which were mostly looked at, the most which was looked at was patient satisfaction. However, when we were actually seeing and looking into more these results, we continue to confirm that there are no specific guidelines for podiatrists. And why is this? Basically, what we've established was that the studies that we've included in the scoping review were mainly from an orthopedic perspective. Orthopedic consultants carrying out foot and ankle management, and they had telemedicine in their practice, but not from a podiatrist point of view, okay? And the preferred, obviously, mode of communication was video calls rather than telephone calls. And we've also noticed that there was a gap in the literature as the studies lacked the methodological rigor needed to be able to come up with a robust framework for foot and ankle management. Also, we've noticed that patient satisfaction should not be the only outcome to give importance, but there should be other outcomes to be taken into consideration, and that is why feasibility studies are preferred, because they can assist us more with whether or not implementation can be successful or not. And feasibility studies, in that case, they would look into further outcomes such as acceptability, demand, implementation, practicability, adaptability, and also integration and expansion, rather than just patient satisfaction. Also, it is important that if we had to integrate telemedicine as part of our clinical practices as another additional service modality to care for our patients, it should be introduced seamlessly and it should not disrupt the services that are already in place. We need to also reassure our patients, as this might be something new and not everyone might be inclined at the beginning to actually use such modality, but we need to reassure our patients that if they have to choose a telemedicine consultation, if they need it, they would be treated just the same, with the same level of care, and it will not be something inferior than in-person care. And also, stakeholders engagement is important, because it's not just only the patients and the podiatrists, but it's also the whole healthcare system and the authorities that need to be engaged with the system to be successful. And following that, we need to be able to help with engagement. We would need more public outreach and professional training as well. The scope and the gist from what we found is that any form of care delivery should always have the patient's welfare as its ultimate objective. Be it telemedicine, be it in clinical, this is the ultimate aim. Okay? So, as all studies have limitations, the limitations, two limitations that we've identified in the scoping review are that some studies might have been overlooked because not all databases have been searched, so only 4 particular databases have been used, and there's a significant heterogeneity of the data among studies due to the different outcome measures used. So it was taken more from an orthopedic point of view rather from a podiatric point of view. So we need something specific to us now. I'd like to conclude. Basically, I'd like to see this as a continuation, and guidelines can guide us in this path, because if we don't have these guidelines, it would be like mixed feelings for everyone. So if there is something set, which we are at the moment working on, in creating a framework for podiatric telemedicine, we can all together create